pleasure to introduce my colleague in the House, in the 1st Congressional District. David has always been a reliable vote in every way, in every step of the way possible, whether it's as we apply for government resources, like this grant, or when votes have come up in the House over 60 times to repeal the Affordable Care Act, or votes to improve healthcare delivery or resources. David's always been a solid voting partner in that effort, and I'm proud to introduce my colleagues in the 1st Congressional District, David Cicilline.
Good morning. I also want to begin by thanking everyone in this room for the work that you have all done. Thank the Governor for her extraordinary leadership in spearheading the Reinventing Medicaid effort, but I know from having spoken to many of you during that process, this was an enormous amount of work. Something I think in many ways can only happen in Rhode Island, where there's this very strong culture of collaboration and where people know each other and work and respect each other's colleagues really know each other. And so to everyone in the room who was part of this effort, thank you, because what we're announcing today with $130 million additional federal investment is really a validation of the quality of the work that you did. So I want to first say thank you. John, it's good to see you again, and thank you for your introduction to the Governor. It's a reminder when we talk about reinventing systems and about overhauling systems, behind this work are individuals whose lives are improved as a direct result of this work, with access to quality care, who improve their health outcomes. So it impacts real people, and it's important that we think about that even when we talk about system reform. I want to acknowledge my colleagues in government, of course, Congressman Landry, Senator White, Senator Reid, not only for their work in Congress, but for their early work, particularly Senator Whitehouse, was a quality institute that really helped to create some of the architecture that he spoke about for electronic medical records and current care and all of the work that is necessary to actually execute what the Reinventing Medicaid group presented. And so those early investments in understanding that we could improve outcomes, reduce costs, and make access available to more Rhode Islanders really required all those early investments and all that really important health care infrastructure. And the Quality Institute, which was really founded by Senator Whitehouse, was really important in that early work. So I want to just acknowledge him in particular. This is, I think, an example where Rhode Island has become a national leader in this area. And it really has been a partnership with so many in the private sector, but it's really recognition that we can provide health care in a more efficient, more cost-effective way, more focused on good health outcomes, and do it in a way that reaches more patients and more Rhode Islanders. And the payment reforms and the medical homes and all the different innovations that are underway are great innovations that Rhode Island should be really proud of and are being watched by people all across the country. And this grant of an additional $131 million is further recognition that this kind of work is making a difference, it's effective, and it's really an example really to the country. So I want to just, again, say thank you to everyone who's been part of this work. I'm proud to be part of a delegation that understands that making sure Rhode Islanders have access to quality, affordable health care matters. It's at the center of our economic prosperity that we have people who are healthy and can work and can actively participate in our communities. And I think we are in for some challenging times in the next couple of years, depending on the new administration's view of Medicare, Medicaid, and certainly our current speaker has articulated a different vision of ending the guarantee of Medicare and turning it into a voucher and requiring older Americans to go out and buy insurance, which would be catastrophic. So hopefully the example of Rhode Island will be evidence and ammunition, frankly, for us to make the case that this current system, when administered properly, can produce good results in a cost-effective way and help us continue to protect Medicaid, Medicare, and other such programs. So thank you for that as well.